Hello students, today I will discuss the contrast X-rays of gastrointestinal tract, and the commonly used contrast media is barium sulfate solution. The barium sulfate solution is prepared by mixing water. Water is about 180 to 200 ml with 120 to 130 grams of barium sulfate. Thus the barium sulfate solution is prepared. But why the barium sulfate solution is chosen for this study? Barium sulfate is commonly used because of its easy availability, it is cheap, and also it has superior contrast qualities. Then what are the indications of barium study? Number one, to note the filling defect of the interior of the GI system. Number two, to note any obstruction, and number three, to note the mucosal pattern. So all these are common indications of barium study. But what are the contraindications? Number one, known or any history of allergy to the barium sulfate solution, and number two, severely ill patients, and number three, if there is any history of intestinal obstruction. Barium sulfate solution, it is not a very tasty solution, it is chalky in taste. So to reduce this unpleasant taste, some vanilla flavor may be added, or some sweetened substance like saccharin may be used to avoid this chalky taste. Now I will discuss the barium study of the esophagus, which is called barium swallow. Then barium study of stomach and duodenum, which is called barium meal. Then for the small gut and the proximal part of the large gut, and it is called barium meal follow through study. And lastly, the barium enema, where we will introduce the barium solution per rectum. So these four study we will discuss, two for the upper GIT and two for the lower GIT. I will show the different X-ray films of this contrast study, and I will discuss one by one. Look at this film. This is the contrast X-ray, and of course it is barium swallow of the esophagus. And I already told you why the barium sulfate solution it is used. It is easily prepared and tasteless or chalky taste, and it is a stable solution, not absorbed by the intestine, and it is not soluble in the water or digestive juice, and non-toxic, but it is having high contrast qualities. Then what is barium swallow examination? Barium swallow, actually in this test the person is asked to drink some barium sulfate solution, about 100 ml solution, and then radiographs are taken during swallowing of this solution, and this suspension is given to visualize the lumen of the GIT and its mucosal defects, particularly in the esophagus. And the films are taken during swallowing and immediately after swallowing, and it takes about 10 minutes time to complete the barium swallow investigation. But what we can see any stricture in the esophagus, we can see any achalasia cardia is there or not, to identify the enlargement of left atrium or any mass or tumor projecting in the lumen of esophagus or not. There are so many indications for this barium swallow study. If I see, the first one is a control study. Control study means without giving barium sulfate solution to swallow, and it is a lateral view. We can see all these are the cervical vertebra, and in front of it, it is a hyoid bone, and this is a laryngeal cavity, and all this cavity are the laryngeal cavity. And here we will get the pharynx and esophagus in between the vertebra behind and larynx in front here. And this barium swallow, it is the anteroposterior view, and we can see the barium sulfate solution, this white area, radiopaque area, this one, and coming down through the esophagus. And this one, it is a again lateral view. This is control lateral, this is barium swallow lateral view. And here we can see all the cervical vertebra behind, and in front I told you this is the larynx, laryngeal cavity. It looks black because of the radiolucent air inside, and this is barium sulfate solution. It is coming downward while the patient swallowing the barium. And this is the esophagus, this shadow, white shadow, radiopaque shadow, this is for esophagus in front of the vertebral column or cervical vertebral column. And here in this film we can see this radio opaque shadow is there. It is epi view or anteroposterior view, and the barium is passing through the esophagus and also coming into the abdomen like this. So this is the cervical part, then thoracic part, and then this is the diaphragm. So this is the abdominal part of esophagus. So we can see the whole length of the esophagus. If you are asked what is the length of esophagus, total length of esophagus is about 25 centimeter. And remember that the esophagus having mainly 4 constrictions. First constriction at the pharyngoesophageal junction, where the pharynx ends and esophagus starts. Number 2, it is constricted due to the arch of the aorta. And number 3, where the left interstitial bronchus is pressing on the esophagus. And number 4, where the esophagus enters into the abdomen through the diaphragm. So there are 4 constrictions of the esophagus there, and we must know. And if there is any filling defect or if there is obstruction, this shadow may be dilated. In case of achalasia cardia, the lower part of the esophagus here may be dilated, and that is a condition where there is neuromuscular incoordination of the lower end of the esophagus and there is loss of peristalsis. So the barium sulfate solution accumulated in the lower part of the esophagus, giving a fusiform or dilated appearance in the lower end. There may be rat tail deformity, but this is, and this, all this barium swallow is not pathological, they are all normal study. And here you can see another barium swallow, but it is lateral view. In the lateral view, we can see this is the sternum in front, and this is the thoracic cavity, and here it is a shadow of the diaphragm, and all these are the thoracic vertebra. In the neck region, this is cervical vertebra. This part is the cervical region because it is larynx. So all these are cervical vertebra, and here in the thoracic cavity we will get the all thoracic vertebra. So behind thoracic vertebra, in front of the vertebral column, we will get the shadow of the barium swallow or barium swallow esophagus. So this is coming downwards, then passing through the diaphragm and reaching the stomach in the abdomen. And this is a negative film. This is also the barium, and this film are similar. This is positive film, this is negative film. Both are anteroposterior view. Next we will show the barium mill.